Ambulance Service. Is the patient breathing?
He's not breathing!
Has the baby fully come out yet?
He's been crushed seriously, he thinks he's dying.
Every year in Britain, 12 million people dial 999 for an emergency ambulance. More than 3,000 a day in the West Midlands.
Right, stop screaming and listen to me. Listen, don't be afraid to push too hard. 1 and 2 and 3. 1 and 2.
CPR in progress. Everyone clear?
Each call tells the story of a person in desperate need.
Can you upgrade it to a red, please? He's been badly beaten.
Do you know what it was you were stabbed with, Dom?
And, with call numbers doubling in the last decade...
Keep going, he's here, the head's here, Neely, yeah. I can! You can!
For our public services, a situation that is now critical.
They've got to find somewhere for him. They can't just say there's no beds.
Is this literally what you've got, what you're standing up in? Got nothing else? OK.
The failure of the system.
Oh, God. Oh, my God. What was he doing? All right, guys, just 1 minute.
Cameras follow cases as they unfold, minute by minute.
2 ambulances, please, if possible. OK, yeah, as long as you're all right, I'll get everybody to you as quickly as I can.
In the control room...
Confirmed life extinct.
Oh, man.
And on the ground.
Sorry for your loss.
As the West Midlands Ambulance Service race to save lives.
They are coming to you. Blue lights and sirens as fast as they possibly can.
Is he breathing? Can you see the helicopter?
Well, you're no trouble, honestly. Everybody needs help sometimes, don't they?
This is the story behind the sirens.
Get out of the way, I'm driving.
Hello, Rambo. How can I help?
Ambulance, please see. Nearest to the possible fatal RTC, please.
Do you know male or female? Do we know?
Got a female, like 23.
And when you say a possible fatal, what is the caller said?
Yeah, I think she's dead.
Right off on out, RETA is 30. That's 30 minutes over.
Saturday, 2 hours into the night shift, an emergency doctor, Richard, and critical care paramedic, Kerry, have been given their third job from the control room. They're part of the Merit team, a specialist resource reserved for the most serious cases.
It's a driver vehicle, single car, has ended up in a ditch somehow. Female driver reports there's significant injuries and unconscious.
The car crash is in a rural location in South Warwickshire. In addition to Richard and Kerry in the Merit car, a paramedic officer has also been dispatched. An ambulance and 2 critical care paramedics from the Air Ambulance night team are already on scene.
I've received head injury, tachycardic, surgical emphysema. The Merit team are still required.
Roger, that's all received.
23 minutes later, Richard and Kerry arrive at the incident.
No, it's at scene, obviously.
Arrive theme mode activated.
Where's the ambulance? Just down
Is
there.
the ambulance at the top?
It's gone. It's just gone.
Just gone?
Yeah, both of them have just gone.
OK.
Just answered. Cheers.
9-8, go ahead.
No, we're at scene, but fire service tells us that the ambulance has pulled off over.
Ah, OK. I wasn't informed about that. Yes, I can see them now.
Right. Jump back in the car. I'll keep an eye
On you again, and I'll talk to you and...
Apologies. I wasn't aware. I haven't been told that...
the left steams.
Thank you.
It's not a fatal car crash, but a 17-year-old is severely injured. She has 4 paramedics and a technician with her, but no doctor, and the nearest hospital is 29 miles away. To save valuable minutes, the crews on scene have decided to start the journey by car and arrange a rendezvous point with the Merit doctor on the way.
Just carry on up to the A3400 crew. Parallel with you, heading north, so I'm just going to try and work out a place for you to stop.
So I think when we get to the next junction that is left, that's the A3400.
crew's here and the medics are here, so they're heading the same direction. They're going to come to there, but obviously we need to try and find somewhere appropriate for them to pull over. 5-3, when you go past the next junction on the left, if you can find somewhere sensible to pull in, 9-8 will meet you.
Yes, I did.
Carry on to the end of there. Got you, 9-8 can see you, so they'll be with you very, very shortly.
26. Yep. Right. Yep.
Hiya, you're right.
Hiya.
So this is Anna, front seat passenger of a small hatchback versus 3, all impacts on her door. So we're suspecting all left-sided injury. Obvious open head, we've got obvious chest.
And you've got everything set up?
Yep, I've got you some fentanyl, some ketamine, I've got you a size 7 tube, a size 4 blade, LMAs.
Cool. Anna, I'm one of the doctors. Just going to have a quick look at you, OK? Okay, so Clearfield Central. So surgical emphysema on both sides, isn't there, really?
The patient, Anna, has a collapsed lung and is struggling to breathe.
That's OK. Fine, so I'm just going to give her 50 marks of fentanyl.
2134.
2134. OK, give it a go.
To maintain an open airway, she will need to be intubated under a general anaesthetic. This can only be done under the supervision of a doctor.
Perfect, yeah. Size 7, is that right? 7.
Not blood, actually, in there.
In cases where there isn't time to get to hospital, Merit Team doctors can perform a range of surgical procedures at the roadside, from amputations to open heart surgery.
Okay, you tap that gavel, have a quick listen. Definitely decrease on the left-hand side.
In the time the medical team have been working on Anna, the control room receives 2 more trauma calls.
Ambulance service, is the patient breathing?
What it is, love, my partner, right, stabbed himself 3 times in his stomach.
Okay, and he's still got the knife, we think?
I don't know, I haven't got a clue.
Okay. Ambulance service, is the patient breathing?
What?
Is the patient breathing?
Just about, yeah.
Are you the patient?
No, obviously not.
Pardon?
No!
I can't hear what you're saying, caller.
Oh, no!
Okay, so is the patient breathing unconscious?
He's been hit with a hammer and stabbed in the back.
So he's got a head injury and a back injury, and he's been stabbed, yeah?
Yeah.
Richard and Kerry are the only doctor-led crew on duty tonight. They're still busy treating their car crash patient and so are unable to attend any of the new trauma calls.
Right, sorry, move that.
17-year-old Anna has been successfully anaesthetised. Dr. Richard can now address her breathing problems. He must immediately perform a surgical procedure to release the air outside her collapsed lung to allow it to re-inflate.
Right, you go down, Jenny. I'm just going to pass that back through. There's that.
Just watch that finger. Okay, through, yeah. There you go, release that, yeah. So, potentially that's touching the thorax, yeah? Because we're giving positive pressure ventilation. So, lung is down. Yeah, just so I'm listening, and then we'll go on to that afterwards, yeah. Cheers, mate. Air entry. Air entry.
That's 97.
More air entry than there was.
Okay, 69.51 blood pressure.
Okay, so let's have a quick recap then before we move. So airway we're happy with, chest we're dealt with, ventilating better. Sats are fine. OK, so extending anaesthesia, so we'll give her 2 of morphine in a bit once the blood pressure's settled down. And we'll start getting ready to go, shall we?
With the life-saving procedure successfully completed, Anna will now be taken to Coventry Hospital for a full CT scan and assessment of her injuries.
Service, is the patient breathing?
Well,
Hello, are you the patient?
I suppose so, yeah.
Okay, and what's happened there?
Listen, I'm in a bad way. I'm sat on my window ledge and I'm thinking about jumping head first.
Okay, well, talk to me first. Okay, let's keep talking. And what's your name, my love?
My name is Sam.
Okay.
I feel like I'm having a fucking breakdown. I just need help.
I understand. We are coming as fast as we can.
The easiest thing for me to do is just jump.
There are 25 call handlers on shift tonight, and they'll take up to 1,200 calls between them. Sally is taking a call from somebody reporting an overdose north of Birmingham.
What's the main reason for the call?
It's my boyfriend.
Your boyfriend, okay.
He's took tablets from what I can see.
Take an overdose.
My daughter's having a panic attack. I'm going crazy and I'm shaking. This fucking idiot keeps taking tablets.
All right, try and stay nice and calm for me, my darling, okay? We're getting some help arranged.
I'm fucking out when you keep taking tablets. Taking a fucking...
No, listen, what's going on there? What's happening there?
Louise is a controller, dispatching ambulances in the area the 2 potential suicide calls are located.
Okay, thank you.
It's her job to prioritise the calls and dispatch ambulance crews to attend.
4336, 22-year-old male taking an overdose, approximately 50 tablets. There's lots of shouting in the background. Can you give us an early update from scene, please?
Okay, you all need to stay calm. Can you get the tablets from him?
Yeah, I got them at the minute.
He hasn't got them. Where are the tablets now?
In the car.
I think he might be having some kind of heart.
The ambulances are on their way, but 2 high-priority calls have come in. A patient with chest pain,
Yeah, he's conscious, but he's shaking a lot.
and another with suspected sepsis. Both crews are diverted to the new jobs, leaving Sally's overdose patient and Sam, the man on the ledge, still waiting for help. Louise calls him back to check the ongoing situation.
Hello, is that Sam?
It is.
Hello, it's the ambulance service. We're getting to you as soon as we can.
I need to get out. I'm going to...
All right.
Doing something stupid.
All right, just calm down. Now, where are you, though? Are you in the house or are you still sitting on the ledge?
The police are here.
The police are with you, are they? Try and keep calm and we will get someone to you as soon as we can, all right? Okay, can you hear me?
Portia, the line's still open, so all I can hear is shouting and swearing in the background.
Portia is a call supervisor who monitors and advises on the more challenging calls.
Hello?
Who's that?
Daughter.
Oh, how old are you, my darling? 50.
I'm really scared.
No, don't be scared.
I'm scared.
So you're saying that your mum hurt you?
Go away! No!
What's happening, my darling?
You listening, Porsche?
I'm shooting my little brother screaming.
How old's your little brother?
He's scared.
You scared? All right, shall I stay on the phone with you, my darling?
She's coming on saying that she's scared. Caller pushed her little brother is there and he's 9. So we've got a 9-year-old on scene as well. I'll ring the police. Hello, it's ambulance control here.
You need fire, police or ambulance?
Oh, sorry, police, please.
Please, thank you.
They're saying it's my fault.
They're saying it's your fault.
I'm really scared.
No, don't be scared. I'm sure it's not your fault. I think they've had a lot to drink, haven't they? Your mum said they'd been drinking.
I can't breathe.
You can't breathe. All right. All right. Try and slow your breathing down, my darling. Try and slow your breathing down. All right. You're all right, my darling. You're going to be okay.
Are you calling the police?
Trying. 6 minutes, I've been waiting now. It's just ringing out.
All right, you're doing really well. I know it's scary when these kind of things happen, though, isn't it? Just let me know if anything happens, then. I'll stay on the phone with you. All right, my darling.
The police emergency.
Hello, it's ambulance control here.
Hello there, Amber.
Hello, can we have your assistance, please?
I argue with my mum a lot.
Oh, you argue with your mum?
Yeah.
Yeah, you're 15, though. That's quite normal, isn't it? My daughter's 17 and we argue. It's just one of those mum-daughter things, I think, isn't it? You know, when you argue with your mum.
Yeah.
Yeah.
You've done well to calm her down like
She's a lot better.
Your Samaritans is kicking in, isn't it?
I was a Samaritan volunteer for probably about 10 years. I think the listening skills with the Samaritans is probably the biggest thing. I think any call that involves children, it can be quite difficult to, you know, kind of contain yourself. All you can do in those situations is just keep reassuring, you know, we're doing our best, we're getting there as quickly as we can, keep going, don't give up.
Can you hear your brother? How far are you away from him?
It's hard not to take some calls home with you. It probably sounds cliche, but you do kind of hug your loved ones a little bit tighter then.
Are they still shouting, are they?
There are still no ambulances available in the Black Country. But Louise spots a crew who are dropping a patient at a hospital less than a mile from the overdose call.
5-7, sorry to bother you. I appreciate you trying to offload. Have you got an ETC at all, ever?
Just about to clear now. Sounds like you've got something special on the offering.
We've got adult male that's taken an overdose, but we've also got children at the address. We've got a 15-year-old who's come on saying her mum's hurt her and that she's scared, and also a younger brother on scene.
Yeah, what's your send the details, please?
Thank you, I'll resend details.
Oh, is that your mum I can hear?
Yeah, I think the police are here, Lou.
The police are there, are they?
Crew states have arrived on scene, have been told to wait in vehicle until they have calmed things down.
So the police are there?
Process I have to follow, yes or no, is the patient. If you listen to
With police and ambulance now in attendance, the children will be referred to the local council's safeguarding team, whilst the overdose patient is given treatment. Sam, the 23-year-old man threatening to jump out of a window, has been waiting for his ambulance for 40 minutes. Paramedics Joe and Suki have just become free.
Fine, great, thank you. Just let you know.
I've spoken with the patient on this one. He's very anxious, very upset.
But he does need help, this day, over.
No worries, mate. We're on our way, over.
Thank you. Control standing back.
You've reached your destination. He's in his house. Yeah.
Police have been on scene for 15 minutes and have managed to calm Sam down.
Morning. Hello. OK, Sam, I'm Suki. This is Joe. What's gone on today?
I just want to end it.
OK, what's made you feel like this?
It's been going on for about 3 or 4 weeks now. All my anxiety levels have just risen, and they've been rising and rising and rising, and tonight they've just blown.
Just got to that point.
I've just got to that point where I've said, you know what, fucking hell, dying has got to be fucking easier than this.
Have
dealing
you
with this.
ever done anything like this before?
Well, when I felt like I wanted to kill
Suicidal?
myself,
Yeah.
I've had suicidal thoughts, but I've never really wanted to carry them out apart from tonight. Fuck it. Just do it.
Never taken any overdoses before, Sam? No. Is that a no?
No. No, but I need help. I need help.
Well, that's a really good step. That's really brave of you, all right?
I need the help. I need the
What we've got, Sam, we've got a team. We're going to get you some help tonight, and we'll take you to New Cross Hospital where you will see a psychiatric nurse there. You will. We'll definitely get you some help, OK? All right. Should we get you on the ambulance then, Chick? Yeah. Yeah, if he needs help, he needs help.
Where am I doing?
You're sitting in the hot seat,
I'm
Sam.
sitting in the hot seat. And I'll tell you what, if I had not rang 999, I would have just been a scatter of bones and blood over that front drive.
Well, I'm glad that that's not happened. OK, Sam, you know, how long has it been since your girlfriend's, like, left?
About 3 weeks.
How many months pregnant is she?
Yeah. I'll show you. This was taken on the 15th February. That's my baby.
Aww.
That's my baby.
That's in Feb.
That's my baby.
There's not a day that passes that I don't get a mental health job on the ambulance. Men, when they're facing mental health issues and problems and stresses, low moods, they bottle it up and they bottle it up until they actually explode. There's still a lot of stigma and a lot of taboo. You seek help, you're almost weak. And that's not right, because we all need help at some point or another in our lives. And to be able to recognise that and be able to ask for help, for me, that's such a brave thing to do.
My anger definitely steps back to from when my mum and dad split up. I resented my mum for it. For the lies that I was told for the last 2 years.
How old were you when that happened, Sam?
I was 14.
Yeah. It was quite a traumatic event for you at that time.
Ambulance service, is the patient breathing?
Yes, she's 50, but she's having spasms of coma. She's having one now. There's a load of blood coming from the bottom.
Okay. But she's having rectal bleeding?
Yeah, and I was completely freaked when I saw this and thought it was a baby, but it's not. It's her bottom, not her vagina.
What can you see coming out?
All I can say is it looks like her bottom is in labour. Something is trying to come out of her bottom. She hasn't had a period in a while.
She hasn't?
June.
Since June? So 8-9 months ago.
Oh, shit. Open it. No, it is. It's a baby. Take all that back. It's a baby.
It is a baby?
There's a head. I can see a head. Oh, my absolute God. Oh, right, baby's out.
The baby's out? The girl or a boy?
Boy.
It's a boy. Okay.
Yeah.
There's an ambulance going on now. I'll leave you with the ambulance, okay? Thank you, bye.
Wow. Oh my God. I didn't even know she was pregnant.
Is it breathing still okay?
I think that's the craziest call I've ever took.
Joe and Suki are now 5 minutes from arriving at A&E with their patient, Sam.
Oh, God. Oh, God. Shit.
Oh, my God.
It's okay.
Yes, love. Big accident. What was he doing?
Just stay here, okay?
Fault. I witnessed it all.
Okay. All right, guys, just 1 minute.
I ain't saying that.
Get out the car.
You calling for another crew?
Yeah, fire as well.
5-3, yeah, we need, we've just witnessed a really nasty RTC on the Tetnall Road. There's one car is actually blowing smoke, and we need fire service. I'm going to have two ambulances, please, if possible.
OK, yeah. As long as you're all right, I'll get everybody to you as quickly as I can.
Yeah, thanks. It's all right. It's a little bit of a nightmare here because it's all happened really quickly. Everyone's quite irate. So, yeah, just as soon as you can, if you don't mind, hon.
Right, this RTC's a make ambulances too. They're all rather irate, and the crew witnessed it all happen as well.
4-6, go ahead.
4-6, thanks. Just to let you know that we don't have much of an update at the moment. One car has hit Central Reservation, Bollard. We don't know how many occupants are in the vehicle. It's just reported as a 4-car RTC received.
Yeah, received. We'll update you when we make scene, over.
Ambulance 4246 and a paramedic officer in a car are immediately dispatched to the crash. But Joe has requested 2 additional ambulances. This leaves the control centre with 1 more still to find on a busy Saturday night.
I'm struggling to get another vehicle to these. There's nothing.
There's 1 ambulance and the officer on the way at the moment, and then literally the next available ambulance we'll have to get to them, but there's nothing available at the moment, so it's not a great situation.
All right, mate, just let me come there, mate, just in case he's hurt himself.
All right, mate. Come on.
Mate, are you hurt yourself anywhere?
No, I'm not hurt, but to be honest, I'd like to move the car.
Hang on, mate, you ain't going to move that car, right? Mate, you ain't going to move that car.
Hang on, Bob, let me move out the way, because people are behind me.
Listen to me. Mate, seriously, my name's Suki. What's your name? Let go of that.
No, mate, hang on, give me them keys.
No, mate, you're not
going to drive this vehicle. I'm not going.
You're not moving that vehicle.
I can't drive.
Just give me the keys, mate, because you're not going to drive this vehicle. Joe, have you called police, Joe?
Joe is attending to a 23-year-old who is trapped in a second car that was struck from behind in the collision.
But what we've got to do, my darling, I can't get you out at the moment, so because the seats are a bit of a mess. But you're OK, and I'm with you. We're going to have to get you out in a second, OK? And we'll get you sorted. The fire are here now. All right, guys. This is the one I'm a little bit, because I can't get this girl out the back. She's shook up, but I can't really examine it because I can't get in there. But she's just got pain in her ribs. And, I mean, they've all got, like, neck and back pain, but the problem is it's all happened so quickly.
Yeah, all around my neck and my back.
Because that's my concern, and that's why I want you to try and stay quite still.
With the help of the fire crew, the 23-year-old is freed from the car.
My daughter could have been killed.
15 minutes after he was dispatched, the paramedic officer has arrived to help coordinate the scene.
Guys, who was in this vehicle? Who were your friends? Have they hurt themselves?
Joe and Suki prioritise the casualties. The driver declines medical attention. Realising the seriousness of the situation, with Joe and Suki's permission, Sam decides to make his own way to A&E with a relative who had been following behind in a car. There are multiple casualties, and having assessed the scene, the paramedic officer updates the control room.
5-5. 5-5, go ahead, over. Yeah, look, I can have a third for this case, please.
All make ambulances 3. Roger, that's received.
Thanks, mate. We've got 5 patients altogether.
Roger, yeah, all received and understood, thank you.
The RTC needs to make ambulances 3.
What? You're having a laugh.
I'm going.
Tell me where I'm going to get 3 crews from. Right, this could be interesting. Lou, are you stacking?
At the minute we've got 14 now. I ain't got nothing anyway.
Sometimes I've literally got no crews to send on these jobs. And you have to start shouting round, I'm going to have to pinch so-and-so, and I'm going to have to pinch so-and-so. Take them from another area, off another job. But, oh, gosh, it's hard.
4245 is just it's an amber backup for extrication.
Which one's that one, sorry?
4245. That's C1. It's an amber backup for extrication.
Oh, in that case, we'll have him then. 4245? Yeah. Right, so go. Let me, can you swap them onto that job then?
Yeah.
That's one crew.
Ambulance 4245 has been diverted to the car crash from a job assisting another crew on a lower priority call. But Louise still has one more ambulance to find for this job, and there are more life-threatening 999 calls coming in.
Is the patient breathing?
He is complaining of a heart problem.
Heart problem. How's his breathing at the moment? Is he gasping?
It's not very good, mate.
Okay, is he gasping desperately?
Are you in the fucking hurry up?
Sir, this is
Yeah.
the supervisor. There's no need for us.
Let me tell you one thing. Anything happens to this chap here, I'm going to come out for you guys first.
Right.
Chop, chop.
We are trying to tell you what you can do to help the patient.
Chop, chop, and tell me what you want me to.
Stop saying chop, chop.
He's gone, mate.
What do you mean he's gone?
He's not responding, so come on, please.
So are you telling us he's...
I'm telling you to fucking hurry up, man.
Right.
There's no breathing at all.
The first available ambulance is sent to the man who's not breathing. But Louise is still one crew short for the car crash.
This might control on mobiles and mobiles.
First call, we need a third ambulance on an RCC, please.
Any vehicle able to clear render aid, please call up. Control standing by.
69, did you make a
call then, Eva?
We'll do it if you want us to, right?
Yes. Thank you very much. Oh, thank God for that.
999.
Are you okay?
35 minutes after the accident happened, 3 ambulances are on scene. Crews can start transferring casualties to hospital.
Thanks, son. Thank you. Okay, see you in a bit.
You couldn't make it up, could you? And they could have killed an innocent family. They'd been and picked their daughter up. All 3 of those could have been dead because of that. Dickheads. Bunch of dickheads. Awful. Awful. We're going to have that car in our faces. That's all I thought. It's really shook me up.
So that RTC that they came across, so they could have killed not only the people in the other car, but the crew, the patient that was on the ambulance as well. It's absolutely awful.
See what, it's drama after drama over here tonight.
You need to get her to remove her clothing from her waist down. Can you do that for me? Right, she needs to push.
No, she no need push because she have only back pain.
She hasn't got back pain, she's in labour. I'm here to help until the ambulance gets there.
Call supervisor Ali is taking the 7th birth call of the shift. The average is just 1.
You need to look between her legs and see if you can see any part of the baby. Is she having another contraction, another pain now?
No, yet no.
Right, tell me when she has one and tell her she has to do what her body's telling her to. So she needs to push, okay? Listen, can somebody go and open the door? Because the ambulance crews will be outside now. Can you see them?
Yes.
Okay, I'll let you go. Thank you very much for your help. Bye-bye.
As the bars and clubs close, alcohol-related calls pour in.
Ambulance service, is the patient breathing?
I can't really tell. She's good. She's puking. She's gone freezing cold, pale. She's on the floor, reptiles.
Is she awake?
She's not awake, no. She's asleep. I seriously think she's dying. My girlfriend's passed out outside, walk about and hungry.
She's unconscious at the moment?
Yeah. I'm on the phone to 999. I'm on the phone to the fucking ambulance. I'm a boyfriend.
In Birmingham city centre, the ambulance service has set up a fixed unit around busy bars and clubs. The police have brought in an injured woman.
What's happened this evening?
I'm obviously like with my friends.
Yeah.
And some person and just started on me.
Yeah.
So I've had to go back.
Yeah.
And then before I looked at my finger and I was like, oh my God. Like, oh, she's like bit my finger. And I was
She's bit your finger?
yeah.
Right, what I need to do is clean that up so I can see what we're looking at. So if you just put your hand over there, I'm just going to squirt some water on it and then clean it up. Right, this might sting a bit, chick.
I don't care.
Yeah. What was the occasion tonight? Just a drink out with your friend?
No, we've gone to watch the Kaiser Chief.
Oh, right. Oh, yeah, the second one on here tonight from the Kaiser Chief. Just let me move your hand. You've lost the nail off your finger and you've taken a chunk out the side of your finger. This is just to obviously keep it clean but add a bit of protection to it because that's going to be quite tender. How much have you had to drink tonight?
Probably more than what we should, but not as much as
What you could?
Yeah.
That's fair enough.
We just like to go out, have a few drinks and go out and then we've done that.
We're gonna get an ambulance down, darling, and we're gonna get you taken off to hospital, all right?
My finger is absolutely
It will.
rotted.
Are you covered for tetanus? It's a human bite, obviously. There's a concern there, so...
Someone bit my fucking finger. What?
I don't know, sweet. I've been doing this a lot of years and I still don't understand why people do things like this. There lies the question, really.
The patient will be taken to hospital, where she'll be assessed for plastic surgery. As the end of the 12-hour shift approaches, Team 4 hand over to the day shift.
So have a good shift.
And you?
I will hand it over to you.
5-3. It's home time now, and a little bit of sleep, or a lot of sleep, before we do it all again tonight. And hopefully tonight will be
slightly less dramatic.
I hope so, mate, thank you.
I'll speak to you later. Have a nice sleep. Good night.
Well, thanks for a grueler, Joe.
Oh, gosh.
Ambulance services, patient breathing.
Hi, yeah, he is. He's popped his kneecap out. He did it on Friday and it's done again.
All right, what's the address?
Sunday, half an hour into the night shift, and a call has come in for a man in Dudley who is in extreme pain.
Can I talk to him?
Okay. He said he can't talk.
Can't talk. Is he in severe pain, yeah?
Yeah, definitely.
All right, okay.
2 ambulances are on scene and they're calling the control room to request support from the doctor on duty.
Got on, thanks guys. Quick request for you, 22-year-old male who apparently has got a displaced patella. 2 crews in attendance. They have attempted multiple times to reduce with the assistance of morphine and Entonox and have been unavailable. Apparently the extrication from this address is going to be quite tight and they feel it's unsafe in current conditions. They've requested your support. Yeah, all received. Thanks.
So, crew request for dislocated knee?
It's dislocated knee, 2 crews there saying that it's a difficult extrication and you can flick it back in.
Yeah.
So you're going to be defence knocked, I'll be straight there. She can be the flicker.
Arriving at destination point on left.
We're going to have to do please say so.
Arrived remote, activated.
Hi there, hi.
We were the second crew on scene. We've got a 22-year-old young guy who dislocated his knee in the week. He did. We've seen at hospital. Basically, what's happened is he's beyond the sofa and he's literally dislocated his left knee again.
Okay.
Because if you see the stairs, they're like really narrow.
Okay.
So the plan was to get him onto the chair to carry him down. We managed to get him onto the chair, and every time we tried to move, he's screaming in absolute agony. And because when you see the stairs and how you get up there, it's not safe for us to carry him down. So that's really why we called you.
That's fine.
As you can see, this is the problems that we've got. And this is a gentleman.
Hi there, hi there. I'm Katie, I'm one of the doctors working with the ambulance service.
All right, I'll talk to you. So this is the problem. He's only had 10 of morphine.
Get used to pain relief. You did this the other day.
Hold that in your mouth.
Listen to me, mate. Okay. But, no, you need to take that long, slow, deep breaths and just keep breathing it. Okay.
The only thing that is going to make it better is to get it back into place, OK? And I know it's going to be a bit cruel to be calm. We're going to need to try and straighten your leg, and it is going to be sore, but if you take deep breaths, Kate is going to flick that back and it'll be done. But listen. I know. Deep breaths, all right? Right, I'm going to take your leg, I'm going to slowly straighten it, all right? Okay. Deep breaths now.
Deep breaths. In. You need to.
Good. Well done.
Well done. All right. There you go. What we need to do is we're just going to try and just hold this in position, OK? Don't bend it again. Yeah, should we splint it? That'd be great. Well done. Oh, you've done so well. It's hot. Is that really painful? Second time this week. It's the fourth time.
Friday.
Since
when I got
Friday.
into the hospital on Friday, a doctor popped it in, and as soon as he put it down, it popped back out, so he popped it back in. Got home, and then yesterday morning, trying to get up that step, it popped in, and then popped out, and then straight back in, so I didn't think of it. I just went to the sofa and day move again. To be fair, this is the first time I've been off the sofa in about 38 hours.
Well done.
So this is going to make your legs straight.
Yeah.
Okay, and then once this is
No.
tight, then you'll be able to move.
So it's going to go really stiff, OK? There you go. So we're just going to lift your leg up. There you go. Well done.
I don't know, I'll get down the steps.
We've got lots of us. When we get to the steps, you can potentially go down on your bum, and we can support your leg.
Just keep this leg
1, 2, 3.
straight.
Push with your good leg.
That's it. Well done.
Keep the leg forward.
Well done.
So you're all right.
Brilliant.
Okay, we'll hop down to the first one, but then we'll sit your bottom down.
And
So
then
your
just
left
slide your
leg's
bottom
going to be
down.
dangling over there. So
Did you go? Oh, you can get this out.
you sure?
Well done.
Now sit your bum down.
Right, you can hold on to me as well if you want.
Sit your bum down.
Right, you okay?
That's it. Got you. That's it.
There you go. That's great.
Good man.
OK.
Just take it easy.
So, yeah, that's fine. What you got?
Another step down, mate. Stand up if you can.
Keep going backwards. Keep going backwards. Backwards.
Hang on. Let me just support that leg for you. Well done. Oh. There you go.
Okay.
Oh, well done.
Awesome. Good work, mate.
OK, brakes off.
Yeah.
Yeah.
Carry on.
Bye. Well done.
Thank you.
The patient, James, will be taken to hospital for x-rays.
Ambulance service, is the patient breathing?
No.
They're not breathing.
No.
Who is it that isn't breathing? Is it your mum or your dad, or who is it?
It's my auntie.
Your auntie. OK, love. Get right by your auntie. Can you hear me? Hello? She's saying her auntie's not breathing.
A call has ended abruptly for a female who is reported to have stopped breathing. There are no ambulances available within 5 miles of the patient, but crew 4141 are on their way to a man who has fallen. It's a lower category call, so they're diverted.
41, thank you. Possible arrest. Believe it is a child caller. So I'm just awaiting further info. Yeah, okay, thank you. Thank you.
I'll call her back. Listen, stay on the line. Is your auntie not breathing?
Oh, she's starting to breathe now.
Is she awake?
Yeah.
She is. Right, we're organising help for you then, okay? Can you put her on the phone for me, please?
Okay, she's on the phone now.
Hello, love, can you hear me?
Yeah. Oh, I think I just left.
That sounded very much like your voice.
Hello? Which from? Every time I asked to try and speak to the adult, it sounded like the child. It might be genuine and they might be scared, you don't know, do you? So, the crew are there now.
What boat is it on? Go on. No, we've got this address knocked on, and the lady that answered said she's not called for an ambulance.
That's all received, thank you. So, does it look like a hoax? They've been diverted off another call that's been waiting for 40 minutes already. They've been diverted off that to someone that might not even be real.
Even though the team suspect the call is a hoax, they can't work on that assumption. Supervisor Portia calls the mobile phone provider to obtain the address registered to the number that made the call.
Hi, I need subscriber details from a mobile telephone number, please. Yeah. Yeah. Is there a landline as well registered? Okay. That's lovely. You've been a great help. Okay. Thank you. Bye.
4141, we've managed to get subscriber details not too far, so I'll send the job through to you if you can head round there and see if anyone there requires an ambulance.
Yeah, fine with us. Thank you.
While crew 4141 go to check the new address, there are 12 patients across the region waiting for an ambulance, with a new 999 call coming in every 20 seconds.
Just repeat the location for me.
Library at Burton-on-Trent.
So there's a gentleman that's just had a fit, is that what you're saying? And somebody's been assaulted?
I can't hear him because everybody...
Okay, move away from where all the noise is. Is he conscious now?
He is conscious.
He is conscious.
His legs still shaking.
Is he still shaking now then, sir?
Yes.
He's still shaking?
Look, we're trying to get him sorted out.
Crew 4141 have just arrived at the registered address of the suspected hoaxer.
Yeah, 4141, have you located anything at this address?
The curtains are all open, it's in pitch darkness. A house appears to be unoccupied.
That's all received, thank you. Rich? They've been to that address, there's no one in the property. It's empty.
Hello, ambulance service. What's the matter? What's happened?
You know, we put a toilet roll on. Put one on and I've cut myself.
So what has happened to you? You've cut yourself on the toilet roll holder?
Yeah.
What we've done, we've assessed your symptoms, and an emergency ambulance isn't needed at the moment, but I know you're in pain, you want to get this seen to. What we'd advise you to do is to get yourself up to the nearest A&E within the hour. Can you go to the nearest A&E?
Can't be more bus pass don't start till 9:30.
Your bus pass doesn't kick in till 9:30.
As the Sunday night shift enters the early hours, call numbers plunge. 1 in 3 are now for elderly patients.
Is the patient breathing?
Yeah.
What's the main reason for the call, please?
You wanted a lifeline of an 80-year-old female?
Yeah.
She pressed the emergency button just now, and she's absolutely hysterical.
Okay, right, thank you. I'll still organise some help for her.
We've got 80-year-old Sheila who's activated a care line because she's got severe abdo and back pain.
We'll go and have a look and see what we can do for her.
Oh, bless her.
64 ambulances are currently available across the region. Paramedic crew Maria and Ungi are the nearest to the elderly patient.
Arrive feed mode activated.
Hello. What's been happening tonight then, Sheila?
I've got this pain on my chest and on my back.
When did it start?
It started about 12 o'clock.
About 12 o'clock. Have you ever had anything like this before?
No, I've never thought so. Please help me.
Okay, sweetheart. Is it in your chest right now?
No, it's in my back.
In your back? Right there.
All that being all in the other side.
Okay. Sheila, have you been in this chair all night?
Yeah.
Okay. Do you normally sleep in this chair?
Yeah.
Right. Do you have any family?
No, not now.
No other relatives at all that you keep in touch with?
Only there next door, but nothing else.
Just your neighbours? How many times a day do the carers come in?
They just come like once in the night time, then they'll be back in the morning. As far as I know, I'm not sure.
Okay. I'm just a little bit worried that you're sleeping in a chair.
And that bed's a bit cold up there. That's why I don't sleep on it.
Okay. Have you not got heating in here?
Just turn most of the radiators off.
We're just getting you a cup of tea and we'll get you some pain relief.
I don't have no sugar in between.
No sugar.
No sugar,
Okay.
Joe.
Take a nice big deep breath in.
I'm a Sikh by faith. For me and my upbringing, anybody that's elderly is looked after by family. These people that are on their own, and that is quite heartbreaking because they're at the end of their lives and they've got nobody apart from us coming to help them, which is quite sad. It's quite sad.
Are there any tablets that you can't take?
I mean, if that was my grandmother, my grandfather, I'd be absolutely mortified. It's the neglect of it.
Graham and his wife Jill have been regularly checking in on Sheila over the past few years.
I live 3 doors down. I was the first one to get involved. Had the rails fitted for her before she was bad, and little alarm units put on the window because she's been broke into 2 or 3 times and attacked in the house. The window's broken in that room. Told them about that weeks ago. And nobody's done nothing. But social services, they just don't seem to be really caring for her. It's wrong. Totally.
Sheila, I'm going to pop you down to the hospital. Should we get you onto the ambulance?
Uncomfortable. Can we just pull you back a bit? Yeah.
You say she's lost a lot of weight.
Right. There we go. All right, Sheila, just relax.
Oh, God.
Sheila, can I have this arm? Just relax that arm a second.
Nearly done, Sheila. Sheila, look at me, Sheila. Sheila. I know, listen, we're going to give you something for the pain, OK? But we need to get this in.
Stop, scratch. No, Sheila, don't
just
move
keep
the arm.
still.
Okay.
Sheila, just relax. You're OK?
Relax.
Just bear with us, OK?
now, yeah?
How long
Stop,
you lived in
scratch.
that house, Sheila?
Oh, a long time.
How many years is a long time? Hey?
Oh, I can't say this in that long.
OK. There we go. We will put a safeguarding referral in for that, but it's a shame there's nothing more we can do. You know, you wouldn't allow that if that was your relative. You wouldn't even allow that if it was your enemy. And it's just the failure of the system. Sheila, this is just a bit of paracetamol, okay? This should work quite quickly, all right? I'll get rid of that pain. Have people spoken to you about possibly go into full-time care?
Yeah, but I don't want that.
Okay.
That's my own.
I know it is. I know it is.
And my husband and me, we live there.
Yeah.
And I don't want to live there. I know you're helping me in this matter.
Yeah.
But I want to be back in the own bed.
Understandable. That's understandable, yeah.
Yeah.
Okay. At the minute, you've got carers coming in twice a day, haven't you?
That's good, yeah.
Yeah. I'm going to suggest to social services that we up that to 4 times a day if we can.
Okay.
Someone in to give you help with cleaning and looking after the house as well.
Yeah.
Somewhere deep inside, something's got a hold on you, and it's pushing me aside. See it stretch on forever.
When I was trained to be a paramedic, I thought, right, okay, it's going to be exciting, blue lights everywhere, saving lives all the time. But sometimes the hardest jobs are the small jobs where you lift up the little old ladies that fall on the floor. It's just that small difference where you're a lifeline to somebody.
You'd better be home soon.
We'll get you sorted, don't worry. Okay. Couple of bumps. There we go.
We might get an hour with a patient, but after that we have to leave them and never see them again. But you still know that they're still going to be in that situation. But I think if you ask any paramedic if they could put someone's life right, they'd love to do it. It's hard to know that there's only so much we can do.
For the first time in my life, that's why I tell you, you'd better be home soon. Don't say no, don't say nothing's wrong. Back home, maybe I'll be gone.
Next on Ambulance.
My 2-year-old daughter, she's really scaring me. Help's already on the way to you. I'm so okay, baby. Oh my God.
So what's happened to little one?